Now here is a news commentary written by Mainur Rahim and read by Mohammad Shahrear Talukdar. In November, the interim government announced that it would provide employment to those injured in the July protests. Many people were injured in the 2024 March student uprising who were physically injured in conditions that could hinder their return to work. For this, the government promises to create some economic and social institutions that can provide them employment. The government also plans to provide employment to the families of those who were martyred and the family members of those who were injured and lost their jobs. Home Advisor retired Lieutenant General Muhammad Jahangir Alam Chaudhary, while talking to the reporters after visiting the Dhaka Central Jail in Karaniganj yesterday, said those injured in the July movement will get employment opportunities in the jails. Home Advisor announced that protesters injured in the July uprising would be given employment opportunities in prisons. The initiative of the government is aimed at providing employment opportunities to them. Meanwhile, in November last year, instructions were issued to all government hospitals in the country to provide free fast-track medical care to those injured in the anti-discrimination movement for life. According to the announcement, all the injured are receiving free treatment at all government hospitals. According to the government's plan regarding the treatment, rehabilitation, and employment of the martyred and injured students of the July-August Revolution under the initiative of the July Martyrs Memorial Foundation and the Ministry of Health, the cabin block of BSMMU Hospital has been taken as a multidisciplinary hospital. The injured who were scattered in different hospitals of Dhaka were shifted to the BSMMU cabin block as per the need through screening. The ground floor of the BSMMU Specialized Hospital has been completely dedicated for the outpatient services of the injured. A physiotherapy service was later added. In the meantime, the hospitals and specialized hospitals of the country have been brought under a network as per the plan of the government. Divisional hospitals and specialized hospitals have dedicated beds for the injured, and injured can easily see what services are available on the dashboard. Specialist doctors are being brought from abroad to treat those who have been shot in the eye, and if necessary, the injured are being sent to specific hospitals abroad as per the advice of experts for better treatment. Meanwhile, a study conducted by the National Institute of Mental Health has revealed that most of those who suffered eye injuries during the anti-discrimination student movement in July-August are suffering from mental illness. A central facility has already been set up at the Institute of Mental Health for the treatment of mental trauma of the movement's injured, and the country's public and private experts have been included under this network. Counseling is being provided to the injured through telemedicine. Last December, the Institute of Ophthalmology, in collaboration with Orvis International, organized a workshop on the vision and mental health of those injured in the July movement. Dr. Saidur Rahman, Special Assistant Professor at the Ministry of Health and Family Welfare, said the process of officially recognizing those killed and injured in the July-August movement has not yet been completed due to the delay in finalizing the database. The government has received the names of over 11,000 injured people, and so far half of the information has been verified. At the end of the verification, the formal recognition and rehabilitation process will begin. The special assistant added that government is working to ensure the treatment, rehabilitation and employment of the injured. The government is not concerned about the cost, he said, adding that an arrangement has been made to send the injured abroad who are in need and likely to receive better treatment. So far, 10 people have been treated in Thailand and Singapore, he said. The special cell on the mass uprising has published a draft list of those killed and injured in the movement on the website of the Ministry of Health and Family Welfare, which is in the verification stage. The maximum limit of the initial financial assistance based on the classification of the injured from the July Martyrs Memorial Foundation has been increased from 1 lakh to 3 lakh taka. The authorities have noticed that many people have already spent a lot of money for treatment. In order to return the money for the treatment, the foundation authorities said that if the bill of the money spent is submitted to the cell with documents, the money will be returned to the injured after proper verification. The interim government is very sincere about the treatment and rehabilitation of those injured in the July-August uprising. The government has announced several times that there will be no negligence in the treatment and services of the injured. If any complaint is filed, the proper investigation of the matter will be carried out and action will be taken against the culprits. There will be no exemption, because this interim government has got the opportunity to serve the country and the people in return for the unquestionable sacrifice of those injured in the July-August student mass uprising. That's the end of the news commentary.